Having a sensitivity to food is not uncommon. Many people have them, and they're not even aware of it. Here, continuing on the topic of food sensitivity, is Dr. Mikell Parsons from the Natural Path Health Center, along with MILLE, OUNESAVATH, one of her patients. Yay, MILLE, we practiced, and I think we got it right. Okay, so welcome to the show. Dr. Parsons, remind us, what is a food sensitivity? We've got lots to talk about. That's why I want to get right to it.
A food sensitivity is one that has a delayed reaction. So we talked about if you eat a piece of shrimp and your throat closes up, that's an immediate response. The delayed reactions are the ones that are much harder. So you could have an allergy response 7 days after you've eaten that food. So it's really difficult to figure out.
And trying to figure out what food caused this reaction is really difficult. That's where you come in.
Yes.
But through testing and that kind of thing, you figure it out. MILLE, you're the mother of 6, which you look absolutely fantastic. I can't even believe it. I'm so jealous. But anyway,
Thank you.
Walk us through your experience with food sensitivities, because right now we're going to get into our children being allergic to food, which is, I'm sure, a horrible feeling for any mom. But you have 6. How many of your children have food allergies?
Really, we know about 5 of them right now, 5 of the children. The baby, who's 1, we really haven't done any testing with, but the other 5 for sure have issues with that. And yes,
So
and
cute.
they it ranges from gluten, dairy. They all have gluten allergies. Then there's dairy, soy for some of them, rice for some of them. Some of them conflict. Many of them conflict. And a lot of fruits and vegetables and nuts too. That makes it difficult because the fruits are supposed to be the fun thing, the safe thing. But
so how did you find out that your first one had food allergies? How did you know there was something wrong?
This has all happened in the last 3 years, and I was just in visiting Dr. Parsons one day myself for my own issues, and I happened to mention something to her, and she said, well, that could be a food allergy.
And what did your son have?
Well, all of them really, especially the older ones, were very picky with what they would eat, which is a common issue. But she said, well, it could be a food allergy. So we brought them in, and we were having lots of other little issues going on, but I didn't imagine that they could all be related to the food allergies. But they did, because most of them cleared up.
And you had mentioned, Dr. Parsons, that one of them, for example, licked their lips a lot. And I see a lot of kids do that to the point where their lips are so dry. So you knew right away that was an indicator.
And eczema.
Okay.
One of her children had eczema, and that's a slam dunk food allergy issue. And also behavior problems.
No kidding. Okay, so some of these symptoms are symptoms that we would never even think to connect the two. Okay, what did you do now? You tested each child here, Dr. Parsons, and you figured out what each one of them was allergic to.
Correct. And the frustrating thing is we are biochemically very different. And even though these children have the same parents, they each are a little individual. And where it was frustrating, and she had a lot of prayer, is that each of her children are so different that their reactions were very different, and the foods they're sensitive to were very different. You know, it's easier when you're just dealing with you, but when you times that by 5 and possibly 6, then it just amplifies. So it's trying to find the right foods that are going to nurture the body and heal the body versus tear it down and stress the immune system.
What causes some of these food allergies?
Some of it is genetics. If one of the parents have food allergies or there's a food allergy history in the family, there's a much greater likelihood that those children will have food allergies, which is why when someone is wanting to have kids, it's important that you get off your own food allergies, because that will increase the likelihood of passing some of that genetic predisposition. Another is overexposure. You're just eating the same thing. If your child is living on chicken nuggets with the wheat batting, covering, the likelihood that you're going to be sensitive to something goes up. We're supposed to eat a variety of foods. The other is an imbalance in the intestine, especially with preemie babies. Their intestinal system isn't fully developed, so when you're eating those foods and they're not ready for them, giving them foods early will predispose them to have problems, or if you're not completely digesting your food.
Okay, that all interesting. So I can't even imagine, MILLE, what shopping is like for you, or cooking.
It's been an adventure.
A very expensive adventure, I imagine.
It has, but though also it changed our eating habits to a much healthier. We watch ingredients so much more carefully. It's just been a really, really good thing. I remember one day we're at the store and I took all 5 or 6 of my kids shopping with me, and the aisle was blocked, and I looked down. I couldn't get through. I sent my oldest son, who was like 11 at the time, to down the aisle to check one of the boxes, the ingredients, to see if we could have that. And I was watching him do that. I thought, wow, he can just read the ingredients and figure out for himself if that's a good thing. And I love that he wanted to make sure he could read all the ingredients, that they were safe. And
well, I'm sure it's such a good feeling to know that they're not getting the symptoms that they were before, and that you're treating them like you should. Wow, that's really great. We commend you. And Dr. Parsons, if you're having a special for those people that might have questions or might want to get their children tested right now. So tell us about that real quick.
So if you're wondering, my child's misbehaving, he's not listening, or they're getting eczema, whatever is going on, if they're really, really picky, that could be a sign that there's a problem. So if you really want to investigate that, then come into the office, I'll meet with you, and we'll do a 30-minute consultation where I'll kind of assess to see, do we need to pursue this further, what's the game plan, or maybe there's another reason why. And we'll do that for $50.
Okay, instead of the normal price.
Instead of the normal
price.
price.
Big discount. Thank you both, ladies, so much for being here. We appreciate it. Really opened up our eyes to what could be wrong with our children. Food allergies. I forget you all the time. Thank you so much.
Thank you.
Appreciate it. All right, don't go away, folks. There's more Central Valley Today coming up right after this.